Hello, everybody. I'm Xiao Yu, and my team members are Augustine Kamara, Bailey Xu, and Ajay Jacob. And I'm honored to be able to speak for our group as a representative for the presentation. And in this presentation, we will focus on regional health literacy and diabetes mellitus of Aboriginal and Torres Strait Islanders. First of all, we will start with the association between regional health literacy, diabetes mellitus, and Aboriginal and Torres Strait Islanders, and the link between cultural, Aboriginal, and Torres Strait Islanders health. And then we will move on to talk about the health literacy and social determinants of health literacy of Aboriginal and Torres Strait Islanders. Finally, we will turn to talk about the culturally competent and safe nursing practice related to our topic. So, let's get started.
The link between Aboriginal and Torres Strait Islander culture and health. Culture can be described as common practices, values, and beliefs that is widely acceptable by a group of people living in a particular geographical area. Culture can influence the health of people in a community. Aboriginal and Torres Strait Islanders view health as a holistic process, whereby the physical, social, emotional, and cultural well-being of a person or a community is maintained. The recognition of indigenous culture in the planning of care is essential in meeting their health and well-being. Lack of consideration of indigenous culture by health professionals is part of the reason for poor health outcomes in their community. Aboriginal and Torres Strait Islander culture views and the link to physical health. The link between health and Aboriginal and Torres Strait Islander culture can be highlighted in the importance they give to their country. Aboriginal and Torres Strait Islander identify themselves with their motherland, which is demonstrated, for example, in their name giving. Once an Aboriginal and Torres Strait Islander does not have an access or relationship to their land, it can significantly impact on their health. The removal of Aboriginal and Torres Strait Islanders from their country or motherland has had physical, psychological, as well as emotional effects on their health. For example, the involvement in land management has positive impact on Aboriginal and Torres Strait Islanders' health, with an increase in physical activities, greater access to bush foods, reduced illicit substance use, reduced alcohol consumption, and decreased access to take-away foods. Historical context. Up till the 18th century, Aboriginal and Torres Strait Islander people had been living in a hunter-gatherer lifestyle. However, major changes happened in their lifestyle when the first Europeans arrived in 1788. Cultural practices and traditional and familial activities associated with finding renewable food and resources that help sustain their spiritual well-being. For instance, connection to the country changed over time. This lack of access to their own food had adverse effects on nutrition, as well as decreasing physical activity, and these are key risk factors for diabetes, playing a significant role in the increase in diabetes rates amongst Aboriginal and Torres Strait Islander people. The link between culture and mental health. Aboriginal and Torres Strait Islander people view mental health as coming from a strong connection to country. This keeps their culture alive and continuous, giving a sense of general health and well-being. The most important thing for Aboriginal and Torres Strait Islander people is the connection they have to their families, their country, to the land, and to the kinship. This gives them the sense of belonging to the spirits across Australia. It protects their mental health and increases their resilience. Connectedness enables a person to cope with problems, broadens their knowledge, and creates a support network leading to a strong cultural identity, which helps sustain good mental health. Relevance of culture to diabetes management. Good mental health is important in coping with chronic diseases. For example, Diabetes is one of the major diseases affecting Aboriginal and Torres Strait Islander Australian population. Diabetes as a disease that causes an increase in the blood sugar levels of an individual, which can lead to multiple complications as the disease progresses. Diabetes can be classified into two types, type 1 and type 2 diabetes. Type 2 diabetes is common amongst Aboriginal and Torres Strait Islander people and typically diagnosed at a younger age. Poor quality of life and the complications of diabetes have been associated with early death of Aboriginal and Torres Strait Islander people. Currently, there is no known cure, and the prevention of type 2 diabetes is imperative. Modifiable risk factors that have been identified with type 2 diabetes include obesity, lack of exercise, stress, and poor diet. Health promotion initiatives give information and advice about healthy lifestyle are designed to help prevent diabetes and assist early detection of prediabetes. However, these programs require good health literacy and confident access of primary health care. However, these programs may not be culturally appropriate and the health messages do not translate to the Aboriginal and Torres Strait Islander community, and there is a culture of distrust of health system. Therefore, health and culture for Aboriginal and Torres Strait Islander people goes hand in hand. Leaving one behind will lead to a negative outcome.
And then we will move on to talk about what is health literacy and social determinants of health literacy of Aboriginal and Torres Strait Islanders.
The gap between Aboriginal people and non-Aboriginal people is a distinct social problem in Australia. This kind of gap is more obviously demonstrated in the field of health. For example, there are 6 times as many as Aboriginal people who died from diabetes than non-Aboriginal people. If they have a basic idea about how to prevent diabetes and reduce the risk of complication of diabetes, the death rate would decrease. Therefore, it's important for health professionals to provide them information about health care and help them to apply this kind of information to their lives. And this is the core idea of the health literacy. Besides the health literacy, there are many social determinants of health that affect the health of Aboriginal people, such as work and transportation. But today, we will focus on 3 main facts that have a great influence on the treatment of diabetes, which are social support, social exclusion, and early life. First, the social support. Social support includes friendship, good social relations, and strong supportive networks at home, at work, and in the community. Therefore, for Aboriginal people, supportive social environments will improve their health conditions. For example, Aboriginal people have higher rates of diabetes than non-Aboriginal people. Due to that, Aboriginal people have more emergency department presentation than non-Aboriginal people. But because of the policies of emergency departments, many patients might unable to be treated on time, especially when Aboriginal people have high emergency department presentation. Therefore, the high access to primary health care is encouraged. Besides that, some basic equipment is essential for Aboriginal people's health. For instance, the pregnant women with gestational diabetes have a high rank risk of type 2 diabetes. Due to that, postpartum screening for pregnant women, especially those who are diagnosed with gestational diabetes, is necessary. All in all, developing supportive environments can promote the health of Aboriginal people. There is a 1-minute video about social support. This video recommends a new social service that helps Aboriginal people manage diabetes.
Diabetes is a big problem in Aboriginal and Torres Strait Islander communities. About 1 in 3 people will get diabetes and they'll need help to manage it. Heard you have diabetes, Bob.
Yeah, the doctor told me I have it. It runs in my family and it's a big problem in our community. The doctor told me I should join the NDSS.
What's the NDSS?
It's the National Diabetes Services Scheme. The doctor or a health worker helps you join and get the free NDSS card. You get cheaper products and lots of good advice and support to stay well.
What about when you travel?
No worries. I can use the NDSS card all over the country. The NDSS is free to join if you have a Medicare card. Ask your doctor or local health centre about joining the NDSS and help fight diabetes in your community.
The NDSS.
Besides the social support, the second determinant we'll talk about today is social exclusion. One of the most common social exclusion between Aboriginal and non-Aboriginal people is the socio-economic disadvantage. Low socio-economic status is considered to be a factor in poor health outcome. Australian Bureau of Statistics finding that about 19% of Aboriginal people living in urban areas reported a total personal weekly income of $1,000 or more each week, which is similar to non-Aboriginal people with a university qualification. However, for the other Aboriginal people who live beyond the urban areas, the highest median incomes was in the 35 to 44-year age group, which is about $625 each week. This is a large gap between Aboriginal people and non-Aboriginal people. Therefore, their health conditions might not be as good as those who have a higher income. In addition, there is a research in 2016 finding that socio-economic disadvantage is one of the risk factors of type 2 diabetes. Therefore, the management of type 2 diabetes in Australia Aboriginal people can be more challenging with limited resources and socio-economic disadvantage. Apart from socio-economic disadvantage and social support, early life is also a crucial determinant for Aboriginal people. The early development and education have a long effect on health in future. For instance, Ashman's research found that if near half of the Aboriginal pregnant women are tobacco smokers during their pregnancy, their children will have a high risk of chronic disease, such as diabetes and cardiovascular disease. Therefore, the early life experience will affect the health of Aboriginal people physically and mentally. In conclusion, social support, social exclusion, and early life are essential determinants for the health of Aboriginal people, especially for Aboriginal people living in the regional areas who are suffering from diabetes.
Finally, we will turn to talk about the cultural competent and safe nursing practice related to our topic.
What does it mean to be culturally safe, and how does it apply to our scenario? Well, Williams in his book defined culture safety as an environment which is spiritually, socially, and emotionally safe, as well as physically safe for people where there is no assault, challenge, or denial of who they are, their identity, and what they need. It is about shared respect, shared meaning, shared knowledge, and experience of learning together with dignity and truly listening. Therefore, to be a culturally competent nurse, especially in a regional setting, it is very important to understand the barriers Aboriginal and Torres Strait Islander people face. Due to their past, these barriers are more than geographic. It is not just based on a location or if they can go to a certain clinic, but rather it is mixed with fear and anxiety. Hence, it is important to understand the particular culture you're dealing with, to build trust with the community and the individual, and understand the appropriate protocols and communication devices. Now, to develop the right trust requires the right attitude. To develop the right trust requires the right attitude. What do I mean by that? Well, as Dr. Nelson defined, to develop and gain trust of the Aboriginal and Torres Strait Islander communities you're working with, it is important to have the right attitude and clearly understand the particular community's culture. It is true that over the years there have been several health problems and a significant gap in literacy. But this shouldn't result in an imbalance of power. I'm going to repeat that. Over the years, it's true there are several health problems and a significant gap in education, but this shouldn't result in an imbalance of power. It is just as important to focus on the positives of these communities as well. Just to name a few, it includes the tremendous resilience and the strength they possessed over the years and still do. This attitude will help evoke the holistic approach to Aboriginal and Torres Strait Islander health, and which will eventually lead down to better health literacy. The local Aboriginal and Torres Strait Islander health clinics. Now, why are those clinics important? Well, if we were undertaking a health literacy project, or simply wanting to understand the literacy of our patients' need or the community's need to beat diabetes, we would begin by consulting this local Aboriginal and Torres Strait Islander health clinics. As mentioned by Dr. Nelson again, these clinics would help us get in contact with key community figures. This is an extremely important step in the process because these figures, these community leaders, would help us understand their culture more in depth, the protocols more in depth, and their communication devices. And this would benefit greatly so that we may be able to produce the right literacy. Moreover, as mentioned by Sandra, this community, or they will be more aware of how and what education they need in order to beat diabetes. So the project is done to be a benefit to the community. So it should be done in partnership with the community. So each step of the way, community should be involved in the research and the education that goes out. Is it just enough to understand the community? No, you have to understand the individual as well. Now, it is also very important, as I mentioned, to connect with the individual patient, to get to know them, ask good questions, be willing to listen to their experience and their knowledge, and most importantly, use your previous knowledge from the clinic, the leaders, to create that culturally safe environment that we mentioned, and to understand how, in cooperation with the person's culture and their family, we can provide the best possible health literacy and eliminate diabetes. The context, the healthcare need, and the health issue. It is unfortunate to see diabetes play a role in the departure of many Aboriginal and Torres Strait Islander people. The Australian government studies in 2014 showed that due to physical inactivity and pure diet, it is one of the major catalysts that leads to the road of diabetes. Therefore, once the above culturally safe environment has been cultivated, we as responsible nurses working in a regional Aboriginal community would be able to provide and hold health educational programs about preventing diabetes by addressing the need for a balanced diet and active lifestyle. Firstly, we will address the community through health posters created in partnership with the community, as elaborated before. And then we would address the individual patient that are presenting to the clinic about living a healthy and balanced lifestyle, leading to the freedom of diabetes. As mentioned by Posh in 2014, we will finally be willing to answer and follow up any questions that the community need rather than leaving the community hanging. This way, we will be able to lead the community down the track of becoming more and more aware and educated about diabetes. Therefore, once we understand the particular culture and build a safe relationship with them, we will be successfully able to educate the community and the individual on how to tackle the previously mentioned social determinants of health and start their own journey to overcoming diabetes by good diet and good lifestyle choices.
And in conclusion, our group have talked about the cultural views of Aboriginal and Torres Strait Islanders are closely related to physical health, and we will discuss the historical background of Aboriginal and Torres Strait Islanders, and the reason why Aboriginal and Torres Strait Islanders have more rates to get diabetes than others. And then improving health literacy can help Aboriginal and Torres Strait Islanders prevent diabetes and detecting early symptoms of diabetes. And moreover, we would turn to talk about the social determinants of health, such as social support, social exclusion, and early life, can all affect health literacy of Aboriginal people. And finally, as a nurse, it is necessary to understand the obstacles faced by the Aboriginal and Torres Strait Islanders and to build trust to help the Aboriginal and Torres Strait Islanders in regional area to improve their health literacy and to accompany them to defeat diabetes. And thank you for watching our video. And we hope this video will help you to understand the culture of Aboriginal and Torres Strait Islanders.